Skill: Infant CPR. Use the RAB-CAB mnemonic to remember the CPR sequence. R stands for responsive. Tap the bottom of infant's foot and shout their name. A stands for activate EMS and get an AED. Shout for nearby help. If someone responds, have them call 911 and get an AED while you start CPR. If you are alone, call 911, perform CPR, and then get an AED. B stands for breathing. Take 5 to 10 seconds to check for breathing or only gasping by observing the infant's face and chest movement. If the infant is not breathing or only gasping, continue to the next step. C stands for compressions. Place the infant face up on a flat, firm surface. If possible, use an elevated surface such as a table or cabinet top. Single rescuers can use either the encircling thumbs technique or the two-finger technique. If the rescuer cannot physically encircle the infant's chest, use the two-finger technique. To perform the encircling thumbs technique, place both thumbs on the lower third of the infant's breastbone, just below the imaginary nipple line, and the fingers encircling around the infant's back and chest. Then give 30 chest compressions. Push hard, about 1.5 inches straight down, and push fast. Use the beat of the Bee Gees song, Stayin' Alive. At the end of each compression, let the infant's chest come back up to its normal position. To perform the two-finger technique, place the pads of 2 fingers on the infant's breastbone, with one touching and both below the imaginary nipple line. Then give 30 chest compressions. The rules for the two-finger technique are the same as for the encircling thumbs technique. Push hard, about 1.5 inches straight down, and push fast. Use the beat of the Bee Gees song, Stayin' Alive. At the end of each compression, let the infant's chest come back up to its normal position. A stands for airway. Open the infant's airway using the head tilt-chin lift maneuver. Be sure not to tilt the head back too far. It will be less than for an adult or child. B stands for breaths. Breaths are an important part of infant CPR and should not be skipped. Cover the infant's mouth with a mouth-to-barrier device if possible. If not possible, cover the infant's mouth and nose with your mouth and make an airtight seal. Give 2 breaths, each lasting 1 second to make the chest rise. Take a breath for yourself between giving the 2 breaths. Continue providing CPR until one of the following occurs. 1. The infant begins breathing. 2. EMS arrives and takes over. Or 3. You become physically exhausted and are unable to continue. If another person is available, trade off about every 5 sets of CPR, 2 minutes.